This week we're talking about the neurologic system, so basically imaging that deals with the brain and spinal cord. So we'll start with an aortic arch arteriogram, and that is typically done in the LAO position. That's the best position to see the three major branches off the aortic arch. You'll want to center approximately at the jugular notch. You can see this is a clavicle coming across here, and so the jugular notch is just right below the sternal end of the clavicle. The first branch off the aortic arch. Remember, the first branch off the aorta are the coronaries, and those are these guys down here. But the first branch off the aortic arch is the brachiocephalic, and the brachiocephalic then bifurcates into the the right subclavian and the right common carotid. The second branch off the aortic arch is the left common carotid, labeled number 6, and then the third branch off the aortic arch is the left subclavian. Now, off the subclavian arteries, that's where the vertebral arteries come off of. So here's a little bit superimposed, but coming off of this right subclavian is this right vertebral, labeled number 4, and then coming off of this left subclavian is the left vertebral, labeled number 5. And so the four main arteries supplying blood to the brain are the right and left common carotid arteries and the right and left vertebral arteries. Here's a good diagram that depicts the common carotids very well. So here at the bottom here we've got the brachiocephalic, and it bifurcates into the right subclavian and the right common carotid, and then you've got the left common carotid, which comes directly off the aortic arch, and then the left subclavian here. At about C4 is when the common carotid bifurcates into internal, which goes on up to the brain, and external carotid artery. The external carotid artery branch is a branch that goes off into like the face area, but the internal carotid artery, that's the one that continues up and goes up into the brain. Now again, off the subclavian arteries, so here's the right subclavian artery, and off of it is the vertebral artery. Remember, that's the one that runs through the transverse foramina of the cervical spine. And then off of the left subclavian artery, again, is the left vertebral artery that goes on up into the brain. Okay, so your right and left vertebral arteries, they join together briefly to form the basilar artery. Then, so they join together for a little bit, and then they bifurcate again into the right and left posterior cerebral arteries. The internal carotid artery bifurcates into, this is the anterior cerebral artery, and then this here is the middle cerebral artery. Now, okay, on the left side, we're going to follow this again. Here's the internal carotid artery, and it bifurcates into, that little nub there is the anterior cerebral artery, and then this one is the middle cerebral artery. Now here it's called the Sylvian, and that's not incorrect, but it's not the most common wording, so you'll want to change that to the middle cerebral. Okay, so then the two anterior cerebral arteries are joined together by the anterior communicating artery. Then you've got these posterior communicating arteries, and they join the posterior cerebral arteries with the anterior cerebral arteries. And all of this forms the circle of Willis, which we're going to go over that again in more depth. Okay, so we're starting off here with a common carotid arteriogram, and so they've placed the catheter at the before the bifurcation in the common carotid artery, labeled number 1. Number 2, then, that is the internal carotid artery, and you'll notice that the internal carotid artery doesn't have any branches as it ascends up into the brain. Okay, the external carotid artery, which is labeled number 12 here, that's the one that has all of the branches to it. So that external carotid artery branches out and supplies the face, the nose, things like that. The internal carotid artery, that's the one that courses on up into the brain. The base of the internal carotid artery is called the sinus, which it just means it's a dilated portion. That's all that means. And then this S-shaped portion of the internal carotid artery is called the carotid siphon. Here's another view of the common carotid artery. So this is the common carotid artery here, and then at about C4 it bifurcates into, here is the external carotid artery. Again, it's the one that has all of the branches off of it that go in off into the face. The internal carotid artery, that's the one that usually does not have any branches, and it ascends all the way up into the brain. Here's another example. This time the patient is facing the other way, because again here we've got the internal carotid, we have the common carotid here. It branches off into external here and internal here. So the external carotid artery, again, the one that has all the branches, so the patient is facing like this would be their eye. Then this is the internal carotid artery. It's the one that courses on all the way up into the brain. Now these images of the common carotid where you can see the bifurcation, that would be considered the extracranial arteriogram, meaning it's not within the cranium at this time. So those are usually you center, you're looking at more the neck versus the inside the skull. So these are centered at like C4, and again, it's mostly to see the arteries as they go up into the neck. Okay, here is some diagrams showing the internal carotid artery, but this now we're looking more into the intracranial. So we're centering more now, at the cranium, and so here would be an AP view of the internal carotid artery as it courses up into the brain, and then it bifurcates into this right here is the anterior cerebral artery. Looks like it's labeled B. Letter B is the anterior cerebral artery, and then letter C, that is the middle cerebral artery. And then on the lateral, same thing. This is, again, same artery. This is the internal carotid. It courses, and then here's the carotid siphon. And let's see, looking close here. Again, letter B is your anterior cerebral, and then letter C, this one, it's kind of hard to tell on this diagram, is your letter C then is your middle cerebral. So the main thing to remember is that the internal carotid bifurcates into the anterior cerebral and middle cerebral. Okay, here's an internal carotid artery arteriogram. So number 4, the label here on number 4, that's your internal carotid artery. Number 1, still the internal carotid artery, kind of looking at the siphon here. Okay, number 2, right in here, that is your anterior cerebral, and then number 3, that is your middle cerebral. So those are the two main branches, the anterior cerebral and middle cerebral. And here is the AP view of that internal carotid as it ascends up to the brain. And again, this branch here is the anterior cerebral, and then this branch here is the middle cerebral artery. Okay, now we're moving into the vertebral arteries. And so this diagram is showing how the vertebral ascends up to the brain. Then you can see the basilar artery. That's where the two vertebral arteries join together briefly, and then they bifurcate into the right and left posterior cerebral arteries. Here's a lateral view of the picture also. Again, this is vertebral, and then this long stretch here, that is again the basilar artery, and then bifurcates into the right and left posterior cerebral. Here's an arteriogram of the so this is an AP view of the vertebral. So this is kind of showing, let's see, this is the left vertebral coming up. Then you can see the basilar, and then you can kind of see where it bifurcates into the right and left posterior cerebral. And Then here is a lateral view, and again it comes up. You can see this, you can kind of see this little segment here that kind of juts forward, and then when it bifurcates into the right and left posterior cerebral, then the arteries extend posteriorly, like to the back of the brain. So here are all four pictures together. So first we have this is an AP view of the internal carotid. And the reason we know that is because only half of the brain is being imaged. Okay, so this is the internal carotid, this is bifurcate, this is the anterior cerebral, and then this is the middle cerebral. So those are the two main branches off of that. And then this is the lateral view of the internal carotid. So again, you can see it come up, it has the carotid siphon, and then again bifurcates. And then I have the vertebral arteries right below that as a comparison. So here, this is the right vertebral, and it joins briefly with the basilar and then bifurcates into right and left posterior cerebral. And again, I can tell that this one is the vertebral because it covers, it injects, all of the brain. It's not just one side. And then this is the lateral, and again, you kind of look for this characteristic segment right here, and then after that segment, then all of the vasculature goes posteriorly to the back of the brain. And this segment is the basilar artery. So at first it kind of looks, they all kind of look the same, and so again it just takes practice looking at them and recognizing the characteristic signs to figure out what's what, especially when there's not bony landmarks. That makes it difficult. Okay, this picture does show the bony landmark, so it's not digitally subtracted. So this is an internal carotid artery. Again, bifurcates into, this is the anterior cerebral, and then this is the middle cerebral artery. So that's a good picture. Also, I want to note very quickly that for these AP views, you want the petrous ridges to be filling the orbits. So the petrous ridges are a chunk of bone that is very dense bone in the head. They actually come off the temporal bone and they jut in. These petrous ridges jut in medially, okay? And you want the ridge of that bone to be over. You want it to be superimposed over the superior rib of the orbit. You want one on top of each other, basically. Then here is a vertebral artery, and again we can see that it comes up, it joins with the basilar, and then bifurcates into right and left posterior cerebral. And again, this circulation is on both hemispheres, where this circulation just stays on the one hemisphere. Here is a comparison of both arteries in a lateral projection. Here is the internal carotid artery, and it has the carotid siphon here, and then here is your vertebral artery, and again here's the basilar, and then from the basilar then the vascular tends to go back towards the posterior. So your internal carotid artery is considered your anterior circulation, and your vertebral arteries are considered your posterior cerebral circulation. Here is the orbital oblique view. This picture is specifically for the internal carotid artery. So here is the internal carotid artery, and again within the orbit you can see this anterior cerebral artery and the middle cerebral artery. You can see that bifurcation really well in this view. And also I want to note that in this view the II is angled so that, see, here's this petrous ridge right here, this big white chunk of bone. On your AP views you want it to be superimposed right over your superior orbital rim. But in this picture, you actually want the petrous ridge below the orbital rim so that you can see that bifurcation.